Hey guys, Dr. Hart here. I've got a few questions for you, NCLEX style questions that we can go over on suicide prevention. I did cover suicide prevention the other day in a short content lecture, kind of narrowing in on the most important points about assessment, treatments, and the steps of the nursing process when it comes to treating a patient who is at risk for suicide. I haven't recorded in a couple of days. I had surgery, carpal tunnel surgery to release the carpal tunnel band that goes around the wrist. It was restricting the median nerve, causing pain and numbness. And also I had trigger thumb. This is when the tendon that helps the finger, it can happen on any finger, mine was the thumb, the tendon becomes inflamed with age and overuse, and the A1 lever prevents it. The lever prevents the tendon from moving smoothly, so they go in and they release the lever, and it affects the carpal tunnel. I also had a small cyst right there that she removed. So everything went well. It's just tough to type right now. But when I do recover some more, I will definitely be having some more videos and more content. I would like to cover schizophrenia next. I believe will probably be the topic that I will cover on the next one. So here's some questions on suicide prevention. A nurse discovers a client's suicide note that details the time, place, and means to commit suicide. Which is the priority nursing intervention and the rationale for this action? Okay, I provide rationales on all of these test questions. So here are your answer choices. Letter A, administering lorazepam, brand name Ativan, PRN, because the client is angry about the discovery of the note. Letter B, establishing room restrictions because the client's threat is an attempt to manipulate the staff. Letter C, placing this client on a one-to-one suicide precaution because the more specific the plan, the more likely the client will attempt suicide. Or letter D, calling an emergency treatment team meeting because the client's threat must be addressed. Okay, and I'll give you a couple of minutes to think about this one. Take a look at the answer choices. Again, this is a priority question, and it's in the stem of the question, which is the priority nursing intervention and rationale. Okay, I'll give you a couple of minutes and we'll come back. Don't forget to share, like, and subscribe. And subscribe to my Nursing with Hart PhD YouTube channel. I've also copying all these videos on my TikTok, which is SuzyQ. And I'm starting to put a couple of them on Instagram also. So you may see those on there too. All right, let's come back to the question. So here you're thinking about always thinking about when you're answering these test questions, right? Maslow's ABCs, safety, okay, and think of the nursing process, all right, when you're answering these test questions. Okay, so with the client, correct answer, this one is letter C. Placing this client on a one-to-one suicide precaution because the more specific the plan, the more likely the client will attempt suicide. Okay, the client has, the nurse discovers a suicide note that is detailing the time, place, and means to commit suicide. Okay, it's one thing for the client to say, I'm feeling hopeless today. I'm depressed today. I am not sure how much longer I'll be around. You may not see me tomorrow. But it's another one that where they're leaving a note and they're leaving detailed plans on how they would carry out the suicide. Okay, that goes to the lethality that I discussed in the lecture. The more lethal the plan is, or more detailed the plan is, the higher the risk of suicide is for the client. So this client should be placed on a one-to-one suicide precaution, which would be where a PCT or tech, patient care technician or nurse would be watching this client 24/7. Okay? However, according to facility policy, whatever that is, whether it's an isolation room, watching them through the window, whether it's having a staff member or a nurse following the client around 24/7, until the doctor is notified and the psychiatrist will come and make an assessment, and then until that suicide precaution is lifted by the doctor. Okay? All right. So let's go over these other answer choices. Letter A, administering lorazepam, Ativan. Okay, so what's lorazepam? Lorazepam, that's the generic name for a benzodiazepine. Ativan is the brand name. You have to know brand name and generic name. That's a benzodiazepine. It's given for anxiety. It's given short term, not on a long term, usually PRN as it is here. Short-term PRN for anxiety. Sometimes benzodiazepines are used for sedation before surgery. They are also used for treatment after the patient has a seizure. Okay. Okay, so administering lorazepam is not the answer here. Okay, because when you are finding a note from the client, giving them lorazepam isn't your first go-to. It may relax them, but it's not your first go-to action here. The action would be to put them on an immediate suicide precaution or suicide watch. Letter B, establishing room restrictions because the client's threat is an attempt to manipulate the staff. Well, this isn't a client threat. This is a client detailing time, place, and means to commit suicide. They're not making a threat. They're coming up with a definite plan where they're going to carry this out. Okay. And letter D, calling an emergency treatment team meeting because the client's threat must be addressed. Again, it's not just a threat. Their intention, according to this note, is that they're going to carry this out. So a client or calling an emergency treatment team meeting is not a quick enough response. So while you're having the meeting, the client can follow through on the note. Okay? So letter C is the correct answer on that one. Okay, number 2. Sorry, I'm operating the mouse a little bit slow. Okay. A client with history of 3 suicide attempts has been taking fluoxetine, brand name Prozac, for 1 month. The client suddenly presents with a bright affect, is much more communicative, and rates mood at 9 out of 10. Which action should the nurse's priority? Which should be the nurse's priority at this time? Okay, we'll give you the answer choices. Letter A, give the client off-unit privileges as positive reinforcement. Letter B, encourage the client to share mood improvement in group. Letter C, increase frequency of client observation. And letter D, request that the psychiatrist reevaluate the current medication protocol. Okay, we'll give you a minute to think about this one and we'll come back to it. Okay, so you have a client with a history of 3 suicide attempts, 3 previous. So that alone puts the client at a higher risk for suicide. Okay, it's going to be part of the suicide risk assessment. One of those questions is on a suicide risk assessment. Have you had any previous suicide attempts? Because if they have, it puts them at a higher risk for future events. Okay. So the correct answer is letter C, increased frequency of client observation, and that's part of your, what? That's an assessment, okay? Those other answer choices are interventions. So again, I'd mentioned before to follow your nursing process, ADPI, when answering these test questions. If you see a test answer choice that sounds like it's an assessment, again, take a closer look at that. I'm not saying it's always going to be the answer, but take a closer look at that answer choice, because assessment in most cases assessment is the first step of the nursing process, and that is the first priority thing that the nurse should do. Okay, and I talked in the lecture about how the client who is depressed, okay, and is having suicidal thoughts, while they are depressed and before they start on medication, they may not have the energy to carry out those suicidal thoughts. They may not have the energy to get out of bed or take care of their personal hygiene. So, but once they start on a antidepressant, fluoxetine and brand name Prozac, what is that? That's an SSRI, selective serotonin reuptake inhibitor. That's an antidepressant used quite often for depression. So now that the client has started on fluoxetine for 1 month, their key words, the next sentence are the key words here. The client suddenly presents with a bright affect. That means the mood has lifted and they are at a higher risk for suicide. Once the mood has lifted and they have been started on an antidepressant, they need to be assessed frequently. Okay? Let's look at the other choices. Letter A, give the client off-unit privileges as positive reinforcement. This has nothing to do with the what it's asking for in the question. Letter B, encourage the client to share mood improvement in group. Okay, not the priority, but they can share their mood improvement in group. But the priority is to increase your assessments, your observations of the client because they have a lifted mood after starting an antidepressant. And letter D, request that the psychiatrist reevaluate the current medication protocol. Again, has nothing to do with the priority. Priority here is to increase frequency of client observation, okay, because of the lifted mood after starting the antidepressant. Okay, next question. A suicidal client says to a nurse, "There's nothing to live for anymore. What is the best nursing reply?" Okay, this has to do with therapeutic communication. I covered therapeutic communication early on in one of my earlier videos, if you want to check that out. Okay, I will link those in this video. I have a playlist of a couple of videos and test questions on therapeutic communication. It's something that a lot of students struggle with, so it's good to practice these questions. Okay, so your client says, there's nothing to live for anymore. What's the best nursing reply? Letter A, why don't you consider doing volunteer work in a homeless shelter? Letter B, let's discuss the negative aspects of your life. Letter C, things will look better in the morning. And letter D, it sounds like you were feeling pretty hopeless. All right, and I'll give you a minute to think about what the answer might be. Okay, let's come back to this one. So the correct answer on this one is letter D. It sounds like you were feeling pretty hopeless. Okay, you're confirming that this is what the client is saying to you. It sounds like, okay, you are doing like a restatement of what the client has said to you. Okay, on this one, so letter D, it helps establish trust in the therapeutic relationship. The nurse is verbalizing the client's implied feelings and allowing the client to validate and explore their feelings. Very important. Okay, other open-ended questions or open-ended statements, I should say, that you, the nurse, can reply with would be, tell me more about that. Tell me more about your feelings about not wanting to live. Tell me more. Go on, tell me more. Those are open-ended statements. Okay, letter A. Why don't you consider doing volunteer work in a homeless shelter? Okay, this letter A is considered a non-therapeutic response of giving advice. Okay, you're giving advice. You're telling the client what to do. Why don't you volunteer in a homeless shelter? How is that going to help them at this moment? Okay, the feeling of not wanting to live anymore. So that's non-therapeutic. Okay, letter B is incorrect. It sounds like the client is, let's discuss the negative aspects of your life. That reinforces the client's hopelessness. Why would you focus on the client's negative aspects of their life? If you're going to focus on any part of their life, you want to focus on their positive aspects of their life, okay? So that's definitely non-therapeutic. Letter C, okay, things will look better in the morning. That is the non-therapeutic technique of giving false reassurance. Things will look better in the morning, okay? And this disregards the client's feelings. You're totally disregarding their feelings by saying something like that, okay? Non-therapeutic of giving false reassurance. You don't know, as the nurse, you don't know that things will look better in the morning, okay? All right, next question. Which strategy should the nurse implement first? There's that word first again, with the suicidal client. All right, here are your answer choices. Letter A, ask a direct question such as, do you ever think about killing yourself? Letter B, ask the client to rate his or her mood on a scale from 1 to 10. Letter C, establishing a trust nurse-client relationship. Letter D, apply the nursing process to the planning of client care. Okay, so again, you're looking for the priority. What's the priority here? All right, you can take a minute, look at these answer choices, and we'll come back. Okay, and on this one, which strategy should the nurse implement first with a suicidal client? Is letter A. Ask a direct question such as, do you ever think about killing yourself? Some people think that talking about suicide or asking this question might make the client think about killing themselves, and that's just not true. You have to ask a direct question. Okay? And the priority is to ask this question because client safety is always the nurse's priority. The nurse must determine whether the client has suicidal ideations or thoughts, whether they have developed a plan, and if they have developed a plan, do they have the means on how to carry out or execute the plan. The client with a specific plan is at the highest risk of attempting suicide. Okay, so we're just going to come out with that direct question. Do you ever think about killing yourself? If they say yes, then you're going to ask, do you have a plan on how to carry that out? If the client is in the home setting or outpatient setting, you are going to ask if the client has access to weapons. Okay, and you are going to get immediate help for that client. Letter B, ask the client to rate his or her mood on a scale from 1 to 10. Again, safety is always the priority. Rating their mood is not the priority in this case. Okay. Letter C, establish a trust nurse-client relationship. Yes, that's important, but safety always takes priority. Okay. And letter D, apply the nursing process to the planning of care. Again, safety is always the priority. You are assessing the client's thoughts and asking if they have a plan, because having a specific plan puts the client at a higher risk for suicide. Okay, last question. The client is newly admitted to an inpatient psychiatric unit. Which of the following is most critical? The most critical critical assessment when determining risk for suicide. Okay. All right. Letter A, family history of depression. Letter B, the client's orientation to reality. C, the client's history of suicide attempts. Or D, family's support system. All right, I'll give you a minute to think about this one. Okay, in this one, the correct answer is letter C, the client's history of suicide attempts. And again, I mentioned earlier, this is going to be one of the questions on a suicide risk assessment that you may cover, that you may have to conduct in the initial assessment, admission assessment, okay, of a client in a psychiatric mental health unit. So suicide risk is higher for individuals who have made previous suicide attempts. About half of individuals who kill themselves have previously attempted suicide. Okay, let's go over these other answer choices. Letter A, family history of depression. That may be one of the questions that you would ask, but it's not the priority, most critical assessment question. Letter B, the client's orientation to reality. Okay, again, not the priority. Then letter D, family support systems. You may ask that later on in the assessment, admission assessment, or whatever purpose the assessment is for. But again, it's not the priority. The priority is to determine if the client has a history of previous suicide attempts. Okay, and that's it. For now, I am going to collect some more test questions for next time, and we'll see you on the next one. Have a great day.